COVID-19 is creating an opportunity to unlock exponential healthcare improvement through technology and medical innovation. In today's time, it is imperative to leverage data management of COVID-19 cases, recovery, deaths through digital health records. We need to strengthen the existing healthcare infrastructure as well as capacity building in healthcare to provide healthcare to all. To shed more light on this, we are joined by a panel of top health tech experts. To lead us into the conversation, I would request T. Radhakrishna, Editor, ET Government. Over to you, sir.
Hello, welcome to panel discussion on rethinking COVID-19 pandemic, preparing, ensuring healthcare access to all. I am joined by Dr. Nitin Madan Kulkarni, Secretary, Department of Health, Medical Education and Family Welfare, Government of Jharkhand, and also joined by Sri Shafaq Khan, Officer on Special Duty, Department of Health and Family Welfare, Government of Jammu and Kashmir, and Mr. Naresh Hasija, Associate Vice President, Public Health India from Mylan Pharmaceutical Company. Hello and welcome to the show today to all my guests. We all know that top priority for any state government is to control the COVID pandemic, reduce the mortality rates, and while doing this, strengthen the healthcare system in the states. I would like to ask Dr. Nitin Madan Kulkarni, what are current your priorities?
See, as we are going through sort of a middle of a storm, main problem and main priority right now is to ensure that all those positive people, all those likely positive people are isolated, they are tracked and they are treated. As you rightly mentioned, the basic intention is to stop the mortality, because infection will be there. Now the economy has opened, country has opened, we are going through unlock. So we cannot say that people will not mix with each other, people will come in contact. Everyone is, in fact, now markets are also fully open, transport is also on. So chances of infection are definitely there, but at the same time, we have to isolate as many people possible as early as possible, so that chances of spreading the infection are reduced to the maximum. And number two, we have to be particularly careful about the elderly and the people with comorbidities. So we are specifically targeting the population above 45 years and who are having comorbidities, more focused on diabetes and hypertension, because these are the patients we are finding that normally they are the ones who are landing in ICU and they are the ones who are difficult to manage. So right now the priority is to test as much as possible, and number two, ensure that all those people who require hospitalization are in hospital in time. Because another analysis very clearly shows that almost 50% of the deaths are taking place within first 72 hours of admission, implying that had they come a bit earlier, we could have done something for them in a more better way. So these are the top priorities for the state government right now, to reduce the mortality, to test and isolate as many people as possible.
I'll go to Dr. Shafaq Khan. Khanji, what has been the experience of Jammu and Kashmir?
Well, as I understand it, it has been the same as in the rest of the country. But my understanding vis-a-vis testing is a little bit evolving and changing. I feel that since we are doing large-scale testing, we are also not doing lockdown. Lockdown has, been gradually opened up. So there we are landing in a situation that lockdown is open, people have started moving, people have started their businesses, they have started their daily routine work, visiting their relatives, going for mornings and celebrating marriages also. I am specifically talking about my state. I understand that there is maybe a call has to be taken whether as to we should be continuing with opening of the of activities in the country, and doing this random kind of testing. On the other hand, the testing at many places has been outsourced to private agencies, private labs, because you want to do more testing, you want to have more numbers tested. Maybe at a point, I'm bit apprehensive that it may become such a whirlpool that we may never come out of it. We are testing, private labs are testing, and it's going and going on, and the lockdown is coming down. We are becoming complacent. Some people think it is nothing. Here, if you move in the suburbs, villages of J&K, they will say it is nothing. It's a hoax. There's no disease. The public transport has been opened. Social distancing is less. I travel by air. There is no social distancing well in air travel also. So we are practically keeping everything open and then testing also. So numbers are due to rise. There'll be an exponential rise in numbers of cases. We may even in a month cross the US. We are number 2. We may become number 1. But as Dr. Nitin said, we'll have to see how we reduce mortality within the comorbid people who have underlying diseases. And that is the key, to either isolate them or to stop in this easing of lockdown. Senior citizens, people with comorbidity should not be allowed. They should be checked. They should not be allowed to travel, or they should be phased out. They should be, segmented out. Younger people, because they have lesser chances. People who are healthy. Children in lower age groups are also not so vulnerable. So, keeping in view the lockdown opening, resuming of activities, and doing massive testing, I think we will land up in a situation where the numbers will go very high, very high. But then how we can administratively, that is the responsibility of the government at the higher level, where there are policy decisions to be taken as to how to isolate the more vulnerable groups of the society, where death is taking more. Death is more, and the number of cases of death are higher. Young people are also dying, of course, but the older 50+ people are more vulnerable, and the number of deaths have been higher. So somewhere a call has been taken, and I think number 2, my concern has been mental health issues. I spoke in the earlier webinar also a couple of months back that the number of people needing help from mental health and psychiatry and psychologists and others is very high. I think we will have to build up a strategy to cope up with people leading to these health issues, maybe open up some special counseling centers, maybe deploy certain people, especially helplines, maybe video, conferencing facilities, where you can talk to doctors, and the doubts and the ghosts in the mind and inside can be also addressed. Because I have seen a lot of people are now frustrated because of economic issues, because of social issues, because of other related issues to COVID. Livelihood has been hit somewhere. Relations, I think, relations have been hit also. I mean, interpersonal relation within the family have also got affected. We see a lot of divorces, women abuse, child abuse, sexual cases of harassment. They have gone very high. I think so. There are 2 facets of this problem. We are a large country. We have large amount of social issues. Whenever something happens, there are religious and social issues which confront us immediately after something happens. So I understand that with these 2 areas, we'll have to take a call as to how to do testing, how to have a lockdown, or maybe have another lockdown 15 days, sudden lockdown for 15 days, and then resume again.
Okay.
Somehow we'll have to strategize.
And thank you, Dr. Khan. I'll come to Mr. Naresh Asija. I mean, state governments are busy in attending the COVID-19 pandemic and minimizing the supporting the public health. What is the preparedness of Mylan? What is the preparedness of Mylans to address the COVID-19 pandemic, especially in support of the public healthcare system in the country?
Thank you, Radha. First of all, let me compliment both the states who have really handled this very well, and kind of preparedness states have shown to us. It's amazing. I think we are able to save life, keep mortality rate low than rest of the world. So we, as a pharmaceutical company, basically we started early in this race, and we are a company like who's totally, I will say 50% of our turnover is from public health across the world. We supply essential medicines to 165 countries. Most of them are manufactured here in India. The pride is that. And with regard to COVID journey, we started in the month of February, where our principal partner Gilead they were testing remdesivir as a drug of choice for COVID. And clinical trial results were coming good. They got US FDA approval, and I think post that our whole backend, I will really compliment our regulatory team, our manufacturing team, R&D team, who all the dots were connected so well. We came in very fast time. We came up with the product, and we could serve the nation. Overall, if you see, we are a company who is like our key mission is to serve 7 billion people across the world. So that is our key mission, and this particular time of COVID has further strengthened our mission. And now I think everybody across India, people have seen us, the way we have served them, and our mission, based on our mission, I think it has given us a lot of power to work with the Indian government. More than 20 states in India, including J&K and Jharkhand, we have partnered to serve both of them.
I'll come to Dr. Kulkarni. Sir, COVID-19 has given challenges, at the same time given opportunities for the state governments. How do you pursue the opportunities, and how you address the challenges? Can you please?
See, obviously challenges were because see, our health systems were not designed to handle such type of epidemic. And more so, we are not sure about this pandemic also. Like problem with this pandemic is uncertainty, and that uncertainty in every sector about the outcome of the disease, about the treatment of the disease. Still, we are not very sure what is the likely duration of this entire pandemic. When is the likely vaccine to be available? And this uncertainty is having its own effects on the system. But having said that, and all of us know how the public health systems are already staffed in a very, I will say, not use but poor, but more or less they are very normally staffed. They are not staffed like other organizations. And so the major problem is to ensure, and initial perception of the people was general was that it will last maybe 2 or 3 months. But now we are already 5 months in it, and when we see no end, the most important challenge right now for me is to maintain the enthusiasm, energy of my field workers, making them continuously go through the same ritual every day. And all said and done, when you continuously see deaths and sufferings around you, it has its own psychological effects on the mindsets of the healthcare providers as well as the normal people. So that, and it also leads to sort of a complacency with the time, that people tend to take it like a routine. But in this particular disease, taking it as a routine might be disastrous for your own health. So one has to be very careful about the protective part of it. So maintaining that morale of the healthcare workers is the biggest challenge right now we are facing. And another challenge which we had was about infrastructure development. But thanks to all the efforts of the central government and the state government, the infrastructure came up quite well. And today we have the situation where all the district hospitals are having ICU and oxygen supported beds, which we never thought in a normal circumstances. So I think that way it has really helped the system to cope up, and lots of trainings have taken place. Now today's situation is that even sub-divisional hospital, there are people who are able to operate the ventilator. Earlier they had never even seen it. So I think this capacity building of the manpower has been a good achievement of this, and obviously this infrastructure we have got. And one of the some you can say some, if you look it as a opportunity, then I think this is a great opportunity for the technology to take over this field. Like you take example of telemedicine. Telemedicine was always a very low key type of affair. People will always say no, doctor ke saath to you have to be in one to one. Then only you feel that patient doctor relationship and all. Now no more. Everyone wants that at least the follow-up visits, at least the routine type of systems. Telemedicine people are very happy, and I'm certainly hopeful that this will be a trend for the future that will definitely increase the availability of our doctors for a more serious patients. So that way it is also advantageous as far as the medical systems are concerned. Another important advantage of this system is the diagnostic services are now very easily available. ECG, you take any diagnostic ECG, ultrasound, X-ray, even CT scans, now you can get right on your mobile, and interpretation is also available. So people are having some, you can say at times, extra knowledge about the medical things which even doctors may not be aware of. These are some good things have also happened. You take example of pulse oximeter. I don't think we would have ever thought of keeping a pulse oximeter at our home. Normal mercury thermometer was more than sufficient, maximum digital thermometer. But now we are having the thermal scanners, pulse oximeters, even portable oxygen cylinders people are keeping at home. And with such a great competition among the manufacturers, obviously it has improved the quality, made these devices more easily available, easily operable, and people are now ready to take it because the costs have also come down with easy availability in the system. I think these are all the major advantages of this pandemic if you look at a positive side of it.
Okay, thank you, Doctor. I'll go to Dr. Shafaq Khanji. Sir, how did you convert the crisis into opportunity, and how are you addressing the challenges in Jammu and Kashmir?
See, Jammu and Kashmir, like other states, again was deficient of these emergency beds, your ventilators, oxygen, plants, the hospitals. This has come up. This blessing has come in disguise that all hospitals are now having ventilatory support at the district level, and we have most of the hospitals. Even we are going to the primary health centers, where our Chief Secretary, sir, is very, very keen to develop a model small hospital as a first referral system, so that a patient at the village level would get some kind of relief at the PhD level. Then, as Dr. Nitin said, telemedicine has been something which was on the shelf. Now it is right on the table, it is open, it is been so beneficial during this crisis of 5 months that a lot of people have got benefited through consultations from the rural areas. Even in cities, we had a lot of people approaching doctors through video conferencing and getting these diagnostic services, examined and checked. Then I would appreciate the concern and the role of the central government. They have been very kind to render whatever assistance which has been in kind and cash both. Government of India has given enough number of funds to all states to cater to the emergency and needs. One more important aspect in my eyes, which I have personally been also wanting to happen, is the happening of the National Digital Mission, which is going to come very soon. So National Health Mission with the Ayushman Bharat and the National Digital Mission. If these three things combine together, this country will have the best and robust healthcare system. I think digitalization of data, digitalization of patient histories, their names, their records, and keeping it on a national database, and then opening that database anywhere in the country, finding out the past history of the patient, the past remedies which he has been taking. I think it will very well augment the healthcare system, combined with our Ayushman Bharat. J&K has also been able to have a universal health scheme, which has got approved by the Government of India as well. Recently, the tendering is gone through, and we have allotted the tenders also. In the Universal Health Scheme, we are going to be ensuring all the groups of people in J&K, whoever is willing and whoever is there to get insured. And a corpus fund of 250 crores has been also sanctioned for this. And it will be one of the exemplary schemes, will lead by example in the state, where we will ensure all the people, journalists, judges, young entrepreneurs, whoever is going to come across, and the cost of insurance would be around 800 to 900 rupees, and a cover of 5 lakhs. So I think if you look at the disease and you say what it has taught us, what we will take away from the disease is that we should prepare our healthcare system for such calamities in future. We can have telemedicine projects, National Digital Health Project, Ayushman Bharat, insure people's lives. I think we could come up. And then what Dr. Nitin rightly pointed out was that capacity buildings. Many of us didn't know how to use ventilators and doctors in the ground situations. So we have a lot of people now who know what a ventilator looks like, how does it work, how to intubate a patient, because anesthetic assistants have come in place, because when you intubate a patient, you need an anesthetist, you need the assistant. So this anesthesia has come up as a very key area in healthcare. Then we have other supportive services which have also come up very vibrantly in the state in the past 5 months. So this is an achievement. This is a takeaway of the disease, and I think it will strengthen us for future, not only pandemics but to regular disease problems.
Thank you, Dr. Khan. I'll go to Mr. Naresh Asija. As the state governments are addressing the COVID-19 pandemic, and which are the areas Mylan would like to contribute, measure, and align with the state governments? If you can elaborate on that.
As you know that our core focus is providing essential medicines actually on time. So for that, we do a lot of back-end preparations, and we participate in the right route, like both the states have corporations. So this is our way. We participate in the tenders, and we would like to be long-term associate of such situations. Here, like for example, we have a lot of essential medicines available in India, and we work with different states. Remdesivir is an example where we have partnered with more than 20 states as of now, and we are aggressively fulfilling their timelines, their demand. The demand is increasing every day. There are newer protocols coming in, and we are participating, and we are trying to fulfill all those demands. Coming to, I think we have a small expectation from that side, like where we expect Dr. Nitin and Dr. Khan to help us in planning it better. Actually, if you see some states here in down south, they have done the same thing. They did their planning of like where they will reach at peak, what percentage population will be active at that time, and what percentage population as per present clinical protocols will require what treatment. Based on that, I think those plannings, they placed orders for 2 to 3 months, so that we also prepare our backend so well. This is a crisis time where we want to serve everybody. So we reached out to them, and I think we could serve them better. So only expectation will be like if we can have a better planning for next few months. I think we are ready with that.
Naresh, you are pointing out that we should have a good inventory management process wherein the requirements should be spelled out earlier so that you can prepare your supplies so that they can come well in time, right?
Sure, sir. Yes, sir.
Right.
Okay, thank you. Dr. Nitin, I mean, we have seen the COVID beginning. We are in the middle of the COVID journey. Of course, we are expecting a vaccine to come out very soon. Everybody is hoping across the world. Now there is a need for strengthening the healthcare infrastructure every state, and every administrator is, of course, every state government is doing their best. Now, if you look at what is the roadmap for doing strengthening the healthcare systems in Jharkhand, I'm sure you must have done some blueprint. Of course, some roadmap already must have started. Can you elaborate on that?
I told first our target is to now ensure that basic all the, like earlier we were providing tertiary care and secondary care only at the not below the district level. But now we are likely to shift it to at least to the block levels where we will be able to provide secondary cares because our systems are getting in place. And
Correct.
secondary medicine we are going to encourage in a very large scale. Already we have got about more than 200 PSCs on board. Then hub and spoke model we are following for hospitals so that the entire digital platform works in a very smooth and particularly the movement of inventories as has been rightly pointed out, planning for the inventories and the smooth movement. Like there is a portal of e-Aushadhi, similar is the portal for, there is a portal for management of the other logistics. So sitting at my office, one can have a look at which PHC is lacking which medicine or which medicine is likely to be over in next 15 days, and then you can replenish it immediately. Most important is that we have to ensure that there is a universal health coverage for entire population. We already have about 87.5% of our population covered under Ayushman Bharat through the central government component and the state government component. But we like to cover those remaining government employees and other left out 10% people also, as Jammu and Kashmir is rightly doing, so that it doesn't become a sort of a family catastrophe whenever such any pandemic or otherwise also it doesn't become a health catastrophe for the family and they are able to access the medical treatment at the earliest possible. Another important thing which we are looking at and we expect that the private sector particularly, while they should be able to come out with some easily operable solutions, particularly diagnostics. See, right now diagnostics is the major bottleneck if you go at the village level. Doctors are available at the PHC level, but without any proper diagnostic mechanisms, it becomes very difficult. So I think with this newer technologies, it should be possible to that someone enters some system and you get the reports in some different manner. It is being done particularly for ECG and X-ray, but not for the pathological test right now. We need to work on it. I think R&D should be able to, this is a good emerging market, and I think they will be more interested than me. But as far as COVID is concerned, again, we are now more focusing on our digitalizing the entire system so that it's a throughput type of system where we can directly access and we can directly engage to the lowest level functionary. There are already various platforms available and they are being used also, but now with this pandemic, their use has become more. Like we already have almost 98% of the population has been scanned twice by our healthcare workers during these 5 months, going to each and every household, checking who are the people likely to be susceptible, who are the people who are already having some symptoms. And now we have got a sufficiently large database of all the people. And I can tell you that in this particular village, these are the people who are having diabetes. So more important challenge is to maintain the regular healthcare services, and particularly in rural areas, providing the normal childcare and maternal health services, which is the topmost priority, and we are also working on that. And within last 2 months, we have recovered it to a large extent. It is not to the as bad it was in April. But now the main challenge is to work protecting the healthcare workers as well as to ensure that the health systems do not suffer. Because if you just analyze the death figures, I think the number of COVID deaths and the number of non-COVID preventable deaths which could have otherwise been taken care of by our health system, there is the figures are telling us something. So we need to ensure that COVID doesn't sort of eclipse our normal healthcare system. We have to deliver, and COVID is just like a disease and it should be treated like one. And it is an infectious disease, bit more infectious compared to other infections. So we are working on that line.
Thank you, Dr. Nitin. I'll go to Mr. Khan. Khan, I mean, for strengthening the public healthcare system in Jammu and Kashmir, what is your roadmap?
You see, I was just wanting to point out the need for strengthening the private sector as well. Private sector hospitals this time have come as a savior to us. At every district level, at state level, we have booked most of the private hospitals. We have had to, ask the Shri Mata Vaishno Devi Shrine Board. They have a hospital in Narayana. It was also taken over by the government at a cost. Then we have a medical college, private medical college hospital in Jammu. We have some hospitals here in Srinagar, very few. But in my understanding, we'll have to have a regulated private sector in India. Regulation is very necessary when it comes to private sector. Not that there were stories on television that they were charging and they were demanding advance 5 lakhs and all that. I agree that is one thing where I say the private sector, a robust private sector has to develop, which will give competition to the government sector, but regulated private sector. We are also anticipating. Our High Court of Jammu and Kashmir has recently ordered why private practice should not be banned in J&K. So we'll have to think on those issues also. If states go for banning of private practice across the country, we may have to then allow private sector to flourish, regulate it very properly, so that it can augment us in times of such emergencies. Emergencies, we are prone, all regions of our country, either through floods or through earthquakes or pandemics like what happened. I think we will have to develop more private sector beds. Wherever competencies are there for government sector, we will enhance our existing infrastructure. But I think as beds are concerned, we may have to give more leverage, more scope to private entrepreneurs to go into this sphere and develop state-of-art healthcare facilities. But meanwhile, I wanted to just have a query with Nitin sir regarding this 80+% which he said is covered through health insurance. Sir, is it covered through Ayushman Bharat, or you have your state insurance also? You have some kind of local state health insurance facility?
We have Ayushman Bharat, plus Ayushman Bharat covers about 27% of the population. Rest of the population is covered through a state insurance scheme. It is at par with the Ayushman Bharat. The terms and conditions remain the same.
What is the way this state insurance thing is running? Is it in trust mode, or you had outsourced it to some insurance?
No, right now we are having a hybrid mode where the insurance is up to 1 lakh rupees. It's through insurance company, and beyond 1 lakh it is in a trust mode.
Thank you, sir. That's just a small, I think 80+% insured people is already a big, huge achievement.
Thank you.
Absolutely, absolutely. I'll go to Mr. Naresh Asija. I mean, states are planning future roadmaps. Of course, everybody wants to strengthen the public health sector, and they need collaboration, they need support system. I'm sure they're open to the new approaches, new innovations, which any value addition comes to the table. What has been your working models and best practices, best strategies that you're already doing? Can you share one or two examples from Mylan point of view?
Particularly in this situation, the health of our employees was the most important thing. That was one thing which we made a notice from the beginning. At the same time, we would like to continue to build capacity of healthcare professionals. So these two things were so important for us. And then to do that, our people used to go to field, used to go to hospitals, used to meet doctors. So we wanted to do all this digitally. I think I will say that one step we took in this area is we converted whole interaction with doctors to digital platforms. So our people started interacting with doctors on digitally. Yeah, I think one of the panelists said it is very difficult for any discussion. You have to meet a doctor one-to-one. The way telemedicine is becoming very popular, so this platform is working very well with us. Secondly, the most I will say that the second important point comes is making sure all the medicines are reaching every nook and corner of the country, whichever state it is. For example, if it is Andhra Pradesh, they want it at 39 locations. our medicines will reach at 39 locations. So we made it a point, we converted whole our supply chain system into a digital supply chain system. So I think that worked very well for us. So anybody and everybody can place their medicines order across the country. We are coming up very soon. We are coming up with a web link, which we will be just floating it. So then I think that next comes is capacity building. Whatever we at our level can work with doctors, nurses, paramedics, so pharmacists. We run a lot of programs for different hospitals. So we were doing it. Now we've started doing everything digitally now. As of now, I will say that blessing in disguise, we have converted this into a digital mode for now.
Okay, thank you, thank you. My last question, Dr. Nitin Madan Kulkarni. Innovation happening in telemedicine. The new concepts like electronic ICUs are in pipeline in some of the states. Some progressive states are following the best practices that followed in Europe and US. I think COVID has given that opportunity as well. Your views on telemedicine, perhaps some of the innovation that you are thinking or adopted already in Jharkhand.
First, we have to accept that it is now telemedicine is the norm and it should be continued for the future, and it should form a part of your now normal healthcare delivery system. Earlier, it was more like an addendum and it was thought of like you are doing something extra, but no, it is no more. It is a part of, very much a part of our system. We have to ensure that telemedicine, if you can provide all the diagnostic services and consultation services, like we have got a telemedicine project running through Apollo hospitals, and in 100 PHCs, they provide the basic diagnostic as well as the basic consultation, and it is working perfectly fine. We also tried a similar telemedicine through homeopathic consultation, and it was also very quite a success in a limited way, that because there are some people who are followers of this package, they felt very good and the people feel very comfortable. So most important bottleneck connecting to the telemedicine is obviously the digital divide. We have some digital pockets and some, or you can say some digital poverty in the country. So connecting all the villages, all the PHCs to the blocks and the districts and the healthcare facilities is the real challenge. Now there is some project of BharatNet going on, which they are offering that they will be providing the connectivity right up to the panchayat level to each and every PSC. Another important is that we have to create a digital health record system. It's already on, but I think that is the need of the hour. Wherever I go, I can access the system and my records are available for the treating physicians to see. So if you have a centralized digital record, I think that is the way ahead where you should look up to, so that my investigation reports are also available for the doctor to see how they have progressed or deteriorated, and that is the only way we can ensure that there is a minimum person-to-person interaction and maximum digital interaction. At the same time, it will also have to be accompanied with a sort of a payment systems, because many of the doctors will be insisting on some payments also. So I think this all has to be bundled in a sort of a package, and I think it should be coming. It must have already been there in the market. It must be further evolving. I am sure that within next 2 or 3 months, you will find that many of the good practitioners are offering you high-end telemedicine services.
Dr. Shafaq Khan, what is the status of telemedicine in Jammu Kashmir and its roadmap, if you can elaborate?
We have linked all our district hospitals with the telemedicine project, and we in fact till last year didn't have a 102, 108 ambulance service, which we launched. His Excellency Governor last year launched this service when we had Mr. G.C. Murmu, sir, as our LG. He launched this service and is very effectively, because telemedicine plus emergency medical response system is on the same platform is very important also. So we will also be wanting to go to the PHC levels, where from we will have teleconsultations, and we will also take a cue from what Jharkhand is doing, that we want to go and partner maybe with some private entities where diagnostic lab services can be run, so that the PHC will become the first referral point for a person to come. his digitalized data will be available there. So we have a huge problem in our state when people straight away walk into a tertiary care hospital for a cold, for just checking his regular BP. You know, we have these associated hospitals of medical colleges in Srinagar. We have the Institute of Medical Sciences, Saura. We have GMC Jammu. Straight away, people will walk in the casualty, in the medical OPD with small diseases. This is a very haywire system. Until and unless we are not able to have this referral system institutionalized, that is, you have to be seen by a medical officer, a general practitioner first. He will refer you, it will be a qualified referral service. Then you will go to a sub-district or district hospital. From there, you will be referred properly under seal and signature. Then you will be able to go to a tertiary care hospital, which seems very difficult a task, you know. Jharkhand, J&K, we have hilly terrain, we have lot of issues when it comes to, you know, implementing at the rural and the levels, highly difficult terrain areas. But nevertheless, at least taking it from the district hospital, sub-district hospital, that we should make a district hospital a model hospital with super specialties, where a person from the PHC should be able to get referral only when he needs a referral, not that he will simply take up and walk into a district hospital. And the same is the case with the tertiary care hospitals and institutes in the state, which are hugely overburdened because of such patients who walk in directly, who some ambulance driver has, you know, asked, he picks him up and puts him into a tertiary care hospital. Then your second, I think, concern was intelligent ICUs, you know, linked to telemedicine. I think that's a very, very wonderful initiative which we have been looking at. And there have been these patients, these pulse oximeters, they are monitors, they are connected to a generalized electronic system, whereby if the beep goes high, the nurse gets an alert. If the heart rate goes high, the doctor gets an alert. If a myocardial infarction takes place, MI takes place for the patient, the doctor, his watch will beep, that software will beep in his watch. So I think these are in the pipeline here. We have had people coming last year. This year we have been into COVID, but we wanted to do some pilots with regards to ICUs, where we would have totally digitalized ICUs, e-ICUs, where there is very, very little human intervention. So I think if COVID is kind and goes away, you know, as soon as possible, we may be able to do these high-end things simultaneously.
Yeah, I go to Mr. Naresh. Mr. Naresh, intelligent ICUs, the telemedicine concept is taking a momentum in India. Your thoughts on that? Do you see any integration of your digital platforms with telemedicine? Do you see any opportunity in these areas?
So what I understood from Dr. Nitin is, like, he is looking into connecting the bottom of pyramid with the medical colleges, right, or maybe other super specialty hospitals. And this, he wants to do it like to stop primary care at the primary care to be provided at our PHCs, CHCs, so that there is less burden on district hospitals or medical colleges. And I think it's an ultimate thought, if you ask me, and this can really solve the problem at our medical colleges, where for small issues, anybody and everybody can go. The same, it is the same situation what happened in the beginning of COVID. Patients were mild, they were just occupying the beds. And I think a lot of you have put a lot of efforts in creating different protocols, making sure patient, maybe mild case, can be quarantined at home. So similar situation, if you want to connect medical colleges with the PHCs through point of care devices, which can transmit the data as soon as possible. It's not only ECG. He said maybe there are pathological machines which are available, which can transmit the whole data to the doctor. As Dr. Khan said, if a doctor gets a beep, if doctor gets a report of a patient, I think now e-prescription is coming up and doctor can always e-prescribe. So this dot can be connected. This can be done in such a way. All equipments are IoT. They are talking to each other. They are point of care and they are all battery operated so that that rural part can be really taken care. So maybe we have seen such models and understood some pilots. I will give this subject to one of our hackathon. We do global hackathon here in Bangalore. So it's very interesting, sir. I think if we can come up with some startup solution in this space, this is really the need of the country actually.
Dr. Nitin, final words from you.
No, final words is that I am very happy to be part of this webinar. Would have been normal circumstances, we would have been sitting in a cozy environments of some good five-star or a good hotel and discussing across each other. But anyway, I think we should be able to make it soon. And I'm really hopeful that with all the efforts of the governments as well as the private sector, because see, this has affected across the board each and every person. And so it is better that earlier we come out with some vaccine or some sure treatment for this. I think we should be able to get past this phase, and you can say that whatever we used to think as normal, but let us revert back to that. And I think this new normal is not being very accepted by the people, and particularly as it has been rightly pointed out, I will again like to stress the psychological impact of this pandemic is tremendous, and we should always try to support each other in whatever way and help each other in whatever way. Thank you.
Thank you, Doctor. Dr. Shafaq Khan, final words from you.
Thank you very much for having me in this very great panel of esteemed participants. As Dr. Nitin said, we would have been in Kovalam in some five-star hotel, but unfortunately we are talking on virtual mode. But let's pray together, all of us, that we become victorious out of this pandemic, because it's a huge challenge. It's a huge challenge. We'll have to keep our spirits high, our levels of focus also high, so that we come. There is no scope for complacency. You know, if we are complacent at any level, the public health system, our administrators, our bureaucracy, if you start taking it easy, we will be in a mess. So I think we all have to integrate together at our higher levels, instill that confidence in people, and instill that a little bit of fear also, that this disease is real, because we are all religious. You know, we believe in religions, we believe in God and God's amazing things which happen. You know, I meet people sometimes who tell me, "Sir, nothing will happen. God will take care." I said, "God will not take care. You'll have to take care of yourself. You'll have to put a mask on your face. Then you will get saved. God is not going to put a mask on your face." So I think we'll have to instill a little bit of fear also by, counseling, by putting out a word through electronic media, wherever possible, that people understand the disease and the repercussions of this disease.
Mr. Naresh, your final words, if you can.
I will say that I think the most important piece right now is all of us being from healthcare profession. I think we have to play our role very well. To play that role, I think if everybody around us is disciplined, I think we can play our role better and we can really serve nation. This is a crisis time and all of us have to be really on our toes in discipline. Thank you. Thank you to have all of you as no panel. Thank you very much.
So with this, we shall conclude our panel discussion, Rethinking COVID-19 Pandemic Preparation, Ensuring Healthcare Access to All. I sincerely thank you, Dr. Nitin Madan Kulkarni, Secretary, Department of Health, Medical Education, Family Welfare, Government of Jharkhand, Dr. Shafaq Khan, Officer on Special Duty to Department of Health and Family Welfare, Government of Jammu and Kashmir, Mr. Naresh Asija, Associate Vice President, Public Health India, a Mylan pharmaceutical company. I sincerely thank you. Thank you very much, sir.
Thank you. It was a pleasure.
Thank you. Thank you very much.
Feel free to visit our partner booth for more information on such relevant topics. No harm in dropping by and saying hey to our experts. They will be happy to connect with you. Do share your feedback about the session at the end. You can also interact with us on social media using the hashtag ETHGIIHS.